Hi, my name is Beverly Mosqueda-San and I'm doing a video proposal for Bradman University Innovation and Technology. Since my proposed app is a point to reference, my proposal study is focused on diabetes management and hospice. The accessibility of information, lack of set of guidelines are main issues that majority of clinicians are facing in dealing with diabetic hospice patients. According to Sinclair, James and Hill in 2012, end-of-life care for diabetes management should provide high quality and efficient care. There are limited US data-based research regarding hospice diabetic patients in terms of glycemic control to compare. Furthermore, American Diabetic Association in 2016 standard of care mentioned the care for patients under hospice. However, the guidelines was vague for clinicians to use with diabetic patients under hospice care. Tight glycemic control is one of the main goals of diabetic management. There are 29.1 million American people that are diagnosed with diabetes. According to National Diabetes Statistics Report in 2014, 11.2 million are patients that are 65 years and older. As the older population increases, as projected by Census Bureau, the death of this population is inevitable. Hospice or end-of-life care is opted for a patient who has life-limiting diseases such as cancer, Alzheimer's, dementia, and heart disease. The majority of the patients who have life-limiting disease suffer from multiple comorbidities that contribute to the patient declining condition such as diabetes mellitus, hypertension, and atrial fibrillation. According to American Diabetes Association in 2016, diabetes mellitus is a condition characterized by the body's inability to use blood glucose for energy resulting to hyperglycemia. Type 2 diabetes mellitus conditions that are either the pancreas does not make sufficient insulin or the body is unable to use insulin properly. According to NHPCO, in 2015, there are an estimated 1.6 to 1.7 million patients are receiving services from hospice care. It focuses more on symptom management than curing. Hospice have life expectancy of the individual that are less than 6 months. With the collaboration, I selected three wonderful people. Two are from the medical community and one is from a non-medical person. The reason behind this selection is to see different perspective of people from different backgrounds in regards with technology being used in healthcare. The first interview I did was with Dr. RT, who works as an internist and a field doctor for 35 years, with extensive training from a foreign country. He is very knowledgeable of latest application to use since he is mobile and have a busy practice. Since the mobile app can access a lot of information, we focus more on diabetes management and hospice. Dr. RT mentioned that the app was very easy to use, it's user-friendly, comprehensive, and complete. One of the best advantages of this app is you don't need a Wi-Fi to access it. He also mentioned about the ethical issues were one of the main points on this innovative app project that I'm proposing since patients can access the information and some might think that they can perform procedures or understand the information in a different light and use it for self-diagnosis. Dr. RT recommends some apps that will be helpful, such as the palliative patient management. As a field hospice NP, I will be using the app he recommended, especially it is related in my field of work. My second interview is with Ms. PM RN, a registered nurse for 10 years and currently works as a field hospice nurse. She pointed out the benefits and issues of using my proposed app. The first advantage she mentioned is the app is user-friendly, easy to use, easy to navigate, accessible. You don't need a Wi-Fi or data to access information. The downside of the app is that information is too condensed and multiple tabs needs to click in order to go to other topics. The issues that she pointed is the ethical issues of using the apps. Since it is free to download, restrictions should be implemented since patients can misread the information and use it for self-diagnosis. Also, she also mentioned about clinicians using the app too much and clinician will be more focused on using the app rather than listening or seeing the patient. The last interview I did was with Mr. TC. He works in the non-clinical department for 5 years. He pointed that the app was very easy to download, user-friendly, but a lot of medical information and words that he did not understand as much but get some of it. He also discusses the ethical issues of information overload and using it for self-diagnosing. The patient might not go to the doctors anymore because it's so organized and complete. So in seeing what medication should a doctor should be prescribing with this kind of diagnosis, and patient might think too far ahead. Lastly, he also mentioned that using these apps should have a boundary, especially with non-clinical people, since the information can be misread or patient might read it in between lines. The Family Practice Notebook, or FP Notebook, was developed by Dr. Scott Moses. It is a user-friendly mobile app for clinicians in primary or emergency care as a quick point of reference for medical information. It is free to download and the app is updated monthly for guideline changes. The organized content of the apps makes it easier for any clinicians to access information anywhere they go. As a field NP, whether I'm covering for custodial or hospice patients, this is my go-to app for references for management. It's very easy to use, especially the categories are by systems. For the diabetes section, the app shows statistics, management, and protocols references that the clinician will need. It also includes diabetic order protocols when patient gets sent out to the hospital. The hospice section will help any clinicians who are unfamiliar with hospice guidelines, protocols, and management. The app also includes management in breaking bad news for patients and family, which a lot of clinicians are having a hard time dealing with. According to Agency for Healthcare Research and Quality 2016, innovation is defined as the implementation or altered or new services, organization structures, or policies that aims to improve one or more goals of healthcare qualities or improve outcomes to reduce adverse effects. According to United Nations Development Program in 2017, there are principles of innovation. The first principle is the design with the user. The application of my proposed app reflected how the software developer designed this app to ensure the solutions are useful for a certain population such as healthcare providers. Understanding the existing ecosystem. Dr. Scott Moses aligned this app to existing technology, legal, regular policies, and partnerships with networks and communities of like-minded practitioners such as the healthcare community. Data-driven. The app uses real-time information to monitor and inform management design at all levels. It also evaluates solutions and areas where there are gaps by updating guidelines and protocols when available. The app also uses feedbacks from users to improve the ease of use to access information. Lastly, innovation should be collaborative. I collaborated with diverse population in introducing my proposed app project. Family Practice Notebook uses published materials that are evidence-based works and guidelines that are approved by the medical community. Thank you for watching my video proposal. I hope you enjoy my presentation. If you have any questions, please do reply on the discussion board. Thank you and have a nice day. Bye.